For a new patient, well, I think they need to weigh up what's best for them, for their lifestyle. But for me, because I'm fairly active, I still enjoyed my sport, various other things, work full time. For me, home dialysis is better because it's less stressful for me. I can just do it every other day.
It's very important for people to have a choice on what they want to be on because of their lifestyle. That some people's lifestyles are different from others.
CAPD for me is perfect, but other types of dialysis are obviously probably better for other people.
There are varieties of treatment, and the more information that you can get, the better, because then you feel more empowered. And I think it was quite heavily suggested by my consultant which was appropriate at the right time, and I'm actually pretty sure that he advised in the right direction.
When I reached 70, the consultant said, Gina, you must go in for dialysis. That will keep you going. I said, I had my life for 10, that is enough. Why should I go? But they said, no, you will have a better quality of life if you go dialyze. Because I used to be sleepy in the chair or a bit lazy, like that.
My choice of dialysis, for myself, I can talk, is hemodialysis. I go in 3 times a week, and those 3 days I think about dialysis. But other than that, when I'm away from dialysis, I don't have to think about it.
I decided to have it at home because I can do it at home in the nights and have my meals and things, everything at home. And be homely at all, without feeling that you are in a hospital or going to the hospital all the time. I have my freedom of doing what I want to do when I do it at home.
It was the renal team at the Royal Free. They explained what one would suit me would fit with my lifestyle. And because I work early in the morning, I get up at 4, start work, I could obviously do CAPD.
Went to see my consultant every 3 months or so, and he said that my kidneys were really failing, that I needed to have a transplant, and my option is to ask the family for a transplant, which I did do.
We were taught very intensively to cope with any situation, and I felt that when we came home you were worrying what was going to happen, whereas having now done it for nearly 5 years, very little happens. It's a very run-of-the-mill situation. Very rarely do you get anything go wrong, but you're actually trained to cope with anything.
Oh, it's very easy. I don't think it's hard. It's very easy. Once you get used to the machine, it's easy. Only thing is, you may take some time to get used to it.
I've been on APD now for 2.25 years, and I find it quite straightforward. The training was fairly simple in the hospital, and then shown how to do it all. And the nurse came over at home and we went through some things.
I was allocated a CAPD nurse, and I had an appointment at the City Hospital, and there she went through the whole procedure with me. She did an exchange for me, explained everything about it, how careful you've got to be, with sterilisation and everything. And I found I picked it up immediately.
If, for example, we've had an instance, I think, where the machine had a problem, you've got call lines direct to the technicians who can advise you. And even if it's a dialysis problem, you can also ring the dialysis ward of the local hospital, the unit you're in, and get an answer there usually as well. The nurses have been excellent from that side.
The staff are absolutely wonderful. They're there 24 hours a day. If you have a problem or you're worried about anything, you only have to phone your CAPD nurse or you phone the hospital, and somebody will help you immediately.
If something goes wrong, there's a helpline, 24 hours helpline, and you can ask them, they will immediately help you.
They give you everything you need, Baxter, all the wipes, all the fluids and that. But then it's down to you to make sure that your environment is clean when you're on CAPD.
Every month You are given a schedule by Baxter, and on there is a telephone number with a date you have to phone every single month, and you just tell them the stock that you've got, and then they work out how much you're going to need during the next month, and then the following week all the stuff is delivered. And the van drivers are wonderful because everything's delivered. They take it upstairs, they put it in your bedroom or wherever you want to store it, and it's always there on the dot. I have to do it 3 times a day, but I was originally on 4 times a day. But you can organise your life around it, and it does not stop you from doing anything. The daily routine that I follow is I do my dialysis actually upstairs in bed. I've got a hook on the wall where I can hook the bags up. I do my dialysis up there in the mornings at 8:30. And then at 3:30 in the afternoon, I've got a stand that a neighbour made for me, which can hook the bags on. And I do that down here. So I can listen to tapes, or I can watch television, or do crosswords. And then the last dialysis I do at 10:30 in the evening. And then after that, of course, I go up to bed. I have no problems with it at all. And I say it takes between 30 and 40 minutes, which is quick. It's in your own home. It's comfortable. And you don't have to trail up and down to the hospital. Plus the fact that now I only have to visit the hospital twice a year.
In the Nottingham area where I live, there is hospital transport available. They come and pick you up and they take you to hospital. But their transport comes an hour or so before. So, you have to be patient. Sometimes you get to the unit maybe an hour earlier than your scheduled time and you have to wait around. Then once the machine is set up for you, you go in, you get on the machine, you run it for 4 hours. And in between those 4 hours, there's drinks available for you whilst you're on the machine, the sandwiches. And if you have any problems, the nurses are at hand.
Living for 6 years without any trouble. So far, I never felt that I'm on dialysis. I get up normally as usual and carry on my life as usual. I don't miss anything.
Being on home hemo, you have the opportunity to be able to adjust your sessions. So if, for example, you wanted to go down to the gym or play football like I have been doing, then you could alter it around to fit in to the sessions you need. As long as you get your 3 sessions a week in, it doesn't stop you doing anything else that you want to carry on doing.
The machine does make a bit of noise, but I got used to it very quickly. Doesn't disturb my wife. And for me, the advantage of being able to just get on with what I do during the day far outweighs any inconvenience at night.
Once you go do it for 1 month, after that it's like you're starting your machine, car and going. Automatically we can connect and do. And now I find it very easy to connect. In a few minutes I can connect everything and start.
The only thing I've got to worry about is make sure I've got my anti-rejection drugs, because I have to take them for the rest of my life. But that's the only thing that I need to have for going away with.
I get on with CAPD because it suits my lifestyle. I've got 3 young children who obviously I can go out with and do things with. Before I was on dialysis, I could hardly breathe and walk. But now I can obviously ride a bike and we go out for walks and we're quite okay with it.
You can still live an active and normal life on hemodialysis, so long as you have the willpower to do so.
We meet friends, we go out for lunch, and we work, and everything is worked round the dialysis. I've never had a problem. We've never had to turn an invitation down because of it, so it's. I mean, my daughter's bought me a water paint kit now. My son's bought me an easel. I'm hoping I might become an artist. You never know.
I really enjoy doing gardening. I go out in the garden and work in the garden for 1.5 hours every day. I think it's an exercise for me as well as happiness for me. make me happy to see the plants and flowers.
The people at work have been excellent, actually. They have been very understanding, very supportive. I finish at 4:30 on the 3 dialysis days, but to be fair, I work sort of 7 o'clock in the morning onwards anyway, so I don't waste any or lose any hours, shall we say. We eat out quite regularly. I play golf, cycle, walks as much as we can, particularly at the weekends, and generally try and do as much as we possibly can.
Having a transplant has given me more freedom and given me more option of going out and doing what I want to do. I feel much healthier, got loads of energy. Go to the gym now 3 times a week. I'm out every single day doing shopping, doing all sorts. Ready to go night clubbing. I'm ready for my holidays. I'm looking forward for them.
Four months after I started on dialysis, we decided we'd like to go down to Rock in Cornwall. So I made all the inquiries with the hospital, who were wonderful, put me on to Baxter, who have a travel department. And there I was told that if I ordered my stuff 3 weeks before we were due to go, the stuff could be all delivered down to we rented a house. It could be delivered there, and it was. We then decided we would love to go abroad, the island of Menorca. And when we arrived, everything had been coordinated between Baxter and the travel agent, and everything was delivered to the villa. Everything was there when we arrived. It was a wonderful relief.
My daughters are in Canada, so if there is a function in their house, I'll happily take my APD machine and go there. To carry the machine, I think it's important because I can do the dialysis night time, and daytime I can go around.
Travel-wise, there is no restrictions. I mean, if you're traveling within Europe, there is dialysis facilities available with an E11 form. There is people who have traveled to America, the Caribbean, and even back into the subcontinent on dialysis.
We are quite able to go on holidays, and I would certainly recommend anybody who's on dialysis to try and get away abroad. There are numerous dialysis units abroad, even in England actually for that matter, where you can book slots and just have a normal holiday. We went to Tenerife, and you literally have to book 6 or 8 weeks in advance as normal, well, longer if you can, obviously. When you get to your holiday, everything is pre-booked for you. You turn up at the hospital, plug you in, and off you go.
I've been away for weekends, but we can't fly for about 6 or 7 months. We're not allowed to fly. But after that, I've got a good holiday waiting for me.
I have done quite a lot of travel, and the most significant piece of that is a visit to visit my stepson in New Zealand for 3 weeks. The airline was very, very good, and they offered to take the machine at no charge. And Baxter made sure there was all the fluid that I needed in the place that I was going to. And I've done several other trips as well within the UK, where again the fluid has been delivered. One change I've made is actually to get an estate car so that I can put everything that I need for a short stay and take it with me.
I find that I can do all the things I want to do. I don't seem to have any restrictions. I just stick to the routine every day, and I feel wonderful.
After the dialysis, my thinking power is better. The concentration of doing things is better. Before I was a bit dull.
The dialysis machine, although it only does 5% of what a kidney does, it actually does keep you at a constant level. I haven't deteriorated at all, so my actual health has been quite good.
Having a transplant makes me feel I can do anything I want to do. You know, I can go out, go abroad, you know, do everything that I wanted to do.
I just look forward to everything now because I am well. And I think it's a shame if people would become nervous, because you do cope, you get into the routine and you just automatically do it.